I'm here today to talk to you about medications for gastroesophageal reflux in infants, specifically a particular one, a proton pump inhibitor called Omeprazole, which is being really widely prescribed at the moment and given to really young babies as young as 2 weeks old. Perfectly healthy term babies who are a bit distressed, crying a little bit, and they've been identified as having reflux and being given these serious medications. Now, in adults with gastroesophageal reflux disease, which is severe and prolonged regurgitation of stomach acid up into the esophagus, which might actually be causing burning, and long-term in adults over years, that burning and damage to the esophageal cell wall can actually lead to esophageal cancer. This is a serious thing. So in adults, when this medication is used, it's weighed up against the risk long-term of that cell damage and that risk of cancer. In adults, it's also weighed up against the risk long-term of that effect of the medication, which is to reduce the amount of stomach acid. And so long-term in adults, sometimes we perform a surgery so that they can stop having that medication and they can stop having that reduction in stomach acid, which can lead to them not being able to metabolize their food quite as well. And it can lead to things like bone demineralization and osteoporosis and various other long-term big problems like that. So it's a balancing act for adults. Why are we using this medication for little tiny babies? These babies who are maybe refluxing a little bit, they've got a bit of regurgitation, maybe even silent reflux or a bit of posset. Giving them this medication is reducing the amount of stomach acid and reducing their ability to actually metabolize the fats and the fat-soluble vitamins and minerals in their milk. That can lead, as we know in adults long-term, it can lead to this bone demineralization, it can lead to all sorts of problems. And in most cases, it just isn't warranted. And do you know what else? It doesn't even work to reduce the reflux. The baby will still be regurgitating, but they just won't have as much stomach acid coming up. It's not a drug to address the regurgitation itself. So what are we going to do? There's another way. Not every family is going to need these prescription medications. And at Babyem, we're very focused on looking at gentle solutions for the family based on causes of the problem and identifying solutions that are gentle for the baby and for the family. If that's something you're interested in, then do join us at our free masterclass.